I'm Amanda Olson from intimaterose.com, and this is video number 3 of a 3-part series on the pelvic floor. The first video we talked about what the pelvic floor is, and we reviewed anatomy. And in the second video we discussed what some injuries and some activities that can lead to pelvic floor weakness are. And in this video we are going to discuss what a Kegel is. So just a review of anatomy very quickly. The pelvic floor is everything that you see in red. So starting at the pubic bone in the front and then coming in and down and around, that's the superficial layer of the pelvic floor, and the deep layer backs up to it. You can see on this view here, everything that you see in red coming off of the tailbone and swinging up to the front is the deep layer of the pelvic floor muscles. And a Kegel is a contraction of the pelvic floor muscles collectively. And when the muscles contract, they squeeze and they lift within that pelvic bowl. So if you can imagine like an umbrella, so when you close an umbrella, it closes and then draws in, telescoping up and in. And that is what the muscles do when they activate during a Kegel. What a Kegel is not is a contraction of the gluteal muscles in the back here. So the large muscles that you sit on have a tendency to want to help out when you're doing a Kegel, but they are not part of the pelvic floor, and that is not a Kegel. So if you feel those muscles contracting, you want to be sure to keep them relaxed, and we're only contracting the pelvic floor muscles. There are ways to isolate the muscles for different conditions, different problems. For example, if you are leaking urine, if you're experiencing urinary incontinence, the leakage is happening in the front, so we would want to strengthen the front muscles. And that would be this triangle right in through here. And a good way to isolate those muscles is to visualize the urethra, this hole in the front where the urine comes out, as a telescope, and you want to draw the telescope up and in. By visualizing that contracts these muscles and closes around the urethra, and over time strengthening in that manner will help provide that stop closure around the urethra. And likewise, if you were experiencing leakage out of the rectum here in the back, you could isolate those muscles by squeezing in through the back. So you would visualize shutting off gas, as if you were going to prevent gas contracting in the back. And if you visit intimaterose.com, we have a progression of exercises that you can do to strengthen the pelvic floor. If you're having trouble feeling the Kegel, sometimes you think you're doing it, but you're not really sure, and you're not, or perhaps you're not feeling any activation happening at all. One thing that can be helpful is to take a towel roll, so just a normal towel like you'd have in the kitchen or in the bathroom, and roll it up and sit on it like a saddle. So you would sit on it here, and what that towel roll does is it provides the brain with some input as to where the pelvic floor is. And then with sitting on the towel roll like this, you would be contracting up and away from that towel roll, so you can feel that lift happening. That's one way that you can help yourself and help train yourself. If you're able to feel the Kegel, an ideal position to start in is lying down, because you're not upright against gravity. So the pelvic floor muscles don't have to work as hard, and you can get stronger and better in that position. And then eventually the most challenging position is in standing, and then adding movement on top of that. And then once you're able to feel a Kegel in those positions, adding the Intimaterose weights for resistance to help strengthen that pelvic floor is a great idea. If you were going to be strengthening any other part of your body, you would add resistance to it, and the pelvic floor is muscles just like anywhere else. So visit intimaterose.com and check out the exercises. You can also see videos 1 and 2 that have excellent information, and be sure to follow us on Facebook and Instagram.